Welcome back to the show. Well, some of us think we know our hearts like the backs of our hands. The truth is, though, we can never have too much information about the one thing that kills more women than anything else.
Bonnie Wendell is a nurse practitioner and coordinator of the Heart Secrets program at Columbia St. Mary's, and she's here to tell us what all women should be concerned about. Thanks for being here, Bonnie.
You're welcome.
Nice
Good morning,
to have
ladies.
you on the show.
Thanks.
Good morning.
Yes,
I
good
think
to be
this
here.
is a really important thing for women. It's the #1 killer of women is heart disease.
It has been for the last century the #1 killer of women.
It's shocking, and I think it sounds like, and I don't know if this is true statistically, but I feel like the younger and younger women are having issues with their heart because of whether it's stress or I guess expectations that we put on ourselves. But I just feel like it's something that's affecting younger and younger women.
It really is, and you bring up a good point. In 2010, the #1 killer of women, of 35-year-old women, was cardiovascular disease. And when we're talking about cardiovascular disease, we're talking about stroke and heart attack.
Wow.
And so that really is amazing at that age group. The reasons are, there's multiple reasons why that is. Part of it is we don't prioritize it, but also the disease may in women look different than it does in men.
And I think that's an important thing to point out. There's this video, this public service announcement that Elizabeth Banks, the actress, is in. It's kind of a humorous approach to it.
It is.
But just by way of setting up the video, her point is kind of like she's a young wife and mom, and it's almost like she's too busy to stop and recognize the signs of heart problems and then do something about it, right?
Absolutely. So as she's going about her day, a very busy morning, she's having symptoms of a heart attack and she's putting them aside. She's, as we all do, as we have the family, we have to get them off on their day. We have other things to worry about. Really, a heart attack really is on the low end of my priority list.
Let's go ahead and take a look at that PSA.
It started out like a totally normal day.
Mom!
Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb estar. What are you doing down there? Did you finish your breakfast?
Ow.
Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. Go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her shoes. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? Just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9. 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women.
What, was she going to clean the house up a little bit
I
before
think
they
she
got
was
there?
gonna straighten
I
up a
totally
bit.
get that. I can have a heart attack, but can you just let me pick up the mess a little bit first?
Absolutely.
You know what, though? I very often in my day when we have guests on this show who have cancer or they've had heart disease or something has happened, I think, how do you have time to have cancer? When you are a busy mom,
Exactly.
I think, how do you have time to take care of yourself if you're that sick? I totally can identify with that video.
And think about prioritizing yourself when you're still well, but you know you have a family history, or that you know that your cholesterol isn't perfect and you should be doing this and this. How are you going to prioritize then? You still feel well. When we as women put ourselves last on the list, we get to the age where our families are finally grown up, they're out of the house, they're moving on, and what do we have left? We're looking forward to retirement, to getting to 80 or 90, but we're not getting there healthy. We have a stroke, we have a debilitating heart attack, and we aren't the people that we were. It really is important at any age, 20s, 30s, 40s, know what your cholesterol numbers are, know what you can do with diet and exercise. And I'm not talking about being a triathlete, turning into a vegetarian. Mindful strategies that you can embrace every day. Some of the keys are 30 minutes of exercise every day. Mindful exercise, you're getting your heart rate up. The other thing is watching your diet. You want to eat half of your meal should be fruits and vegetables. Watch the red meat. We all know these things. But when do we really embrace them and make it part of our lifestyle? And that's what we're looking to do with our Heart Secrets program. And we have special events coming up. February 20th, we at our main hospital on the corner of North and Lake Drive. Our hospital is actually dressed in red this month to bring the awareness of cardiovascular disease. I'm really proud of the fact that Columbia St. Mary's has really put the passion forward and having the buildings lit in red all month for cardiovascular awareness. February 20th, we're at our main hospital, 6 to 8 p.m. And what we're going to have is a night to fill your heart with wellness. Different Zumba exercise, some heart-healthy snacks, music, entertainment, opportunities to talk to physicians. We'll be giving brief explanations, but to really be able to sit and talk one-on-one like this with a physician. And then the 27th of February from 6 to 8 at our Ozaki campus, which is out on Port Washington Road.
I think it's wonderful, and we have a graphic with all those dates there for you. Again, as Bonnie mentioned, the Heart Secrets program going on 6 to 8, a healthy night out, Wednesday the 20th, and then also February 27th, which is a Wednesday. The phone number you can call for more information is 414-963-WELL to register for these special events at any of the locations. Space is limited, so you do want to make sure that you give a call today. Thanks.
Nice to have you. Thank you.